All, welcome to the session. Today we'll be continuing with the general first aid. Apart from that, you have another question in your syllabus that is related to specific first aid types. So today I'll be taking general first aid. I'll be completing that, and apart from that, I'll be also going for the specific one that will be asked in your exam. So in the last class, I had stopped at chemical burns. So I'll be continuing from here. So I hope in the last class, there are no doubts. So I'll be proceeding with the next slide. Now here for electrical burns, make sure that you do not become the next casualty. Watch your own safety. Now for a first aider, if you want to help any casualty who is entangled with live electrical wires, make sure that you do not become a victim along with the person whom you are going to save. So that is very important. That is very important. If possible, switch off the current. Otherwise, insulate yourself. Remove your watch, rings, wear rubber boots, or standing on insulating mat. Dry thick newspaper or wood. Now, this is the reason why we ask the electricians or the electrical people to remove the jewelry, whatever they have, including the rings, the chains they have, and the belt buckles and other things that may conduct the electricity. Alternatively, pull the casualty from the source. Now, this if only if it is possible for you to pull out the casualty from the source, they do. If not, try to do as per the previous step, that is insulate yourself and then try to rescue him. Now check immediately for breathing or heartbeat. Now this is very important with related to the electrical systems, because depending upon the amount of the current, time and the path and the type of the current, the casualty may have different types of behavior that you need to go for the first aid. The very first thing that one should check is his breathing and the heartbeat. The both. If he's not, then according to the previous slides, what we have shown for breathing and not breathing, what to do and what not to do, you have to start that. When the casualty is breathing, cool any burned areas and apply a clean, non-fluffy covering from the burned area. So here you need to go for the general burn techniques for the first aid. You will apply the cool water or whatever you have the cool things there. And here it says you use non-fluffy covering on the burned areas. This is very important. Do not use sponge or anything. That will reduce the oxygen. What you call to the burnt areas. That is, if it is not, then it will take longer time. Now, bandaging. Now, what is the meaning of bandaging in medical terms? It is a piece of soft, usually absorbent gauze or other material applied to the limb or any part of the body as a dressing. Now, to cover by wrapping a piece of gauze or another material. This is what the medical science says for bandage. That is why you can see in picture I have shown different types of bandage. rather than what the traditional bandages that medical people use. Now here, what is the purpose of bandaging? Now the purpose of bandaging is to cover a break in the skin that helps to control the bleeding and protect against the infection. This is what we do to when you apply a soft pressure onto the bleeding area or onto the skin, that protects from the excessive bleeding. Apart from that, when you apply the antibiotics powder or any cream and then you go for bandaging, that gives protection against the infection. Now, dressings are pads of gauze or cloth that can be placed directly against the wound to absorb blood or other fluids. Now, another purpose of this particular bandage is not only for protecting the infection or to control bleeding, but apart from that, if there is slight bleeding even after the bandaging, this particular bandage absorbs the slight fluid or the blood that is oozing out. Cloth bandages cover dressing and hold them in the place. That is why if you can see this very clearly, if you are using bandage that is synthetically made, after some time you see that it changes its position when you are what you call when you are working or something doing with your hands and the bandage is on the hand. The other side, if it is a cotton bandage, then it holds very properly. So you have any questions regarding this first aid, general first aid? If not, I'll just move with the other part.
Yes, sir.
So this is also part of your subject code IS 106. Now this is based on specific question that is for first aid techniques for suffocation, artificial respiration and toxic ingestion. Now this toxic ingestion can be poison ingested by a person purposely, or it can be during food, or it can be during your work procedures. So coming to this World First Aid Day, can anyone guess when is the World First Aid Day? Can anyone guess when is the World First Aid Day? No guesses, I'll move forward then. See, this is the World First Aid Day is celebrated annually in the month of September in the very second Saturday. There is no specific date for this. Yes?
September 14.
Yes?
14 September, sir.
Yeah, that was last year, second Saturday of September month. So you have just Googled up and saw that. That you can see on the image when you Google up, it gives World First Aid Day on 14th September. But usually, if you go into the details, it is every year in the month of September and on the second Saturday. So it's not specific that you go for the 14th September. Then, what is the meaning of first aid? Some of the things I'll be just repeating again over here. So first aid is a matter of common sense, application of mind, swift response, immediate and temporary care given to an injured person. This is very important because first aider gives only the immediate and temporary care to the injured person, not more, nothing more than that, till the first aid or your ambulance arrives. Now, it can be usually readily using readily available materials by a bystander until effective medical aid arrives. Now here, what is the meaning of bystander here? Now he is telling that a first aid can be given by anyone with whatever readily available materials that are available to us by a bystander until a effective medical aid arrives. So what does this bystander means?
Anyone standing around in the place is called a
Means
bystander.
those who have nearby to the victim.
Yeah, he can be a trained, untrained person. He can be anyone from the public area who really has the intention to help. That is what the bystander he literally means.
మనం ఎందుకు క్రియేట్ చేయకూడదు ఈ తప్పు నచ్చకుంటే వనరు అమ్మేస్తే రాగరా
Then first aid for artificial respiration. See, as in the last class, we talked about the normal breath of a person. Now here he has given, as per the institute, it is 15 to 18 times in 1 minute. But average for adult, it is 12 to 20 times. But the normal is average is the 16. So first above the first of all, we have to observe the victim, whether he can hear, feel, or observe the surroundings. If he can, that means if he is conscious, he is not subconscious or fainted, or he is out of breath, then in that case, artificial technique is not applicable because he has the breathing mechanism of his own and he can breathe naturally. Then the if the victim of the electrical shock, drowning, and the gas poisoning, choking have a difficulty in breathing, they may stop breathing altogether. Then artificial respiration could be a saver of their life. Now I will ask you guys, what is the first aid for choking? Like say we are having the food and suddenly something has choked. If you are alone, then what you will do to save yourself? Or say one of your colleagues who is having food has choked up. How you will help as a first aider?
Apply sudden pressure on the abdomen, above the abdomen, from behind.
లోవర్ అబ్డమన్
No, this is for yourself or for the victim?
For the victim.
You mean to pressure behind?
No, sir. We will stand behind him and we'll apply pressure with our hands on the upper abdomen, below chest.
Okay, this is for then if you are alone in the house. See, if you are alone in the house, take the chair. If you have like dining chair or something of that sort, whatever chair you have, put just below your chest, upper part of the abdomen, press and try to cough it out way at a very, with a blow so that it comes out. Then for children,
For children, we'll have a suction kind of thing available, which should be readily available near us.
no, same as the old one. Just pat on it, just bend him.
Yeah. Pat
Bend
on the
him
back.
and give pat him with the blows behind his shoulder blades. The same can be applied for the adult also. Now we'll see this in bit detail inside. Now, since most of the people die within 6 minutes, after they stop breathing, artificial respiration should begin as soon as possible after the breathing difficulty is noticed. Now here it is 6 minutes, but as per the institute, but usually we count for 3 minutes to give within the first aid within 3 minutes if CPR and other things are required. So a person is feeling difficult in breathing, depending upon his condition, you can give him the first aid. Then before starting your first aid, respiration techniques call for emergency services. So whatever you have within your, say, if you have a larger organization where there is a nurse or there is a doctor, you can ask for them. Or if your company has some sort of agreement with the hospital, you can call them, or you can go call the emergency services of the government, whatever it is. Then there are 3 methods that is used for artificial respiration. What are these 3 methods? One is mouth to mouth or mouth to nose. Then chest pressure arm lift. This is called Sylvester method. Then back pressure arm lift. This is called Holder Nelson method. I'll show you these pictures. You can understand that. See this, you are well versed, mouth to mouth, pinch the nose, put your lock, the other person's lift the chin, and you give him the pressure. Check for chest rise and chest fall. That is the method. The same thing if a person wants to give mouth to nose, lift the chin, close the mouth, then you can give him the breathing through the nose. Then most practical method is mouth to mouth or mouth to nose. Now this is the method for back pressure, Holder Nelson method. You can see the person is lying on his chest with arms folded onto his forehead. Then the pressure is applied onto his shoulder blades.
যদি আমরা বাংলা বলে কি বলবো, সে ধ্বনি সে আমাকে সাহায্য করবে, যদি সে ধ্বনি সে আমাকে সাহায্য করবে।
And this is the Sylvester method. You can see this is just opposite to the previous one. This is the person lying in normal position. Both the hands are folded onto his chest and the pressure is applied onto the chest. This is Sylvester method. This is another diagram that is for electricians. They're training the people always. The students are getting practical training. In fact, this first aid is also a practical training rather than a theoretical like this. So here we'll see into other parts. The first aid for suffocation. Whenever you have a suffocation, first ensure that the patient's airway is clear. Check for respiratory rate. You can check. Last time we had discussed different points where you can check the respiratory rate or rise and fall of the chest. You can see whether it is normal, below normal, or something of that sort. Check for level of cyanosis. Cyanosis is a condition of a victim or a patient when the oxygen levels within his body comes down and the body starts becoming blue. Don't take this grant for poisoning. Even in some poisoning, there are chances that body becomes blue. But either whatever the case you are going for first aid, we'll go for that also to poisoning. That is in the last part, toxic chemicals when they use what to do, what not to do. But in normal case, if the levels of the oxygen within the body becomes down, then it becomes slight blue. That is what we say cyanosis. Cyano means blue. So cyanosis is the condition of bluing of the victim. In case of drowning, tilt to one side with the head down. Now, most of these, we are well versed with this case in movies and all we have seen, wherein the person has to tilt the face of the person and he starts giving pressure on his abdomen. Then asphyxia caused due to swelling of the throat or asthma can make victim sick. Now the swelling of the throat may be because of allergic foods or something, or it can be because of the asthma. When the asphyxia is the condition of suffocation, the technical term. Yes. Yes. So then, if he is suffocating, make him upright and take him to a fresh air where he can breathe normally. Then, in case of suffocation by gases, the first thing what we can do is to remove that victim and let him breathe fresh air. This is with where works we carry out in like it is like confined area. Of course, in confined spaces without gas test we don't allow. But if the oxygen levels in some tanks or room it is less, then immediately the first thing is you save yourself, take the victim to the fresh air. Then for all the victims, lose the clothing around the neck. Now, if a person is wearing, the top button or something of like tie, then you can loosen his clothes so that he can breathe freely. If breathing gets restored, we give him sips of cold water. This we discussed why we give sips of water in our last class. If breathing does not restore, then start artificial respiration by whatever method we have seen in the last slide. Then first aid for toxic ingestion. This toxic ingestion is taking off the poison. Now seek immediately medical help for poisoning by swallowing. If a person has deliberately swallowed poison for some reason, if he wants to go for suicide or something of that sort, then immediately first thing you can do is you can go call for a medical help. Now in home, say, or at some place you have met such a situation that deliberately a person has tried to suicide by taking poison, then what is the first action that we can do? What is the first help that we can do to such a person?
Vomiting. Make him vomit.
Yes.
Make him vomiting.
Yeah, how you will induce the vomiting? You're right. You can you'll try to get him vomit, but how?
Sir,
Vomit.
give a salt,
By
salt water.
giving him lots of salt water.
Yes, sir.
Salt water.
The help of soap water.
No soap water. Don't give him.
Salt water, sir. Salt water.
Salt water also don't give him, Kaka. This stuff, that is what we say stomach cleaning. You don't try to do that. In some
Okay, sir.
cases, it will not work. It may cause extra problem to the person, but because some of the things that chemicals we use in the home, for example, your mosquito repellent liquid, you see on that
Plenty.
one, it is written treat antidote, treat symptomatically. Whatever the
Sir,
symptoms it develops, then you do go for that. Yes.
plenty of water, sir.
No, see, even if he drinks plenty of water, that will what will do? Of course, it will dilute, but immediately it will go to the bloodstream, isn't it?
Okay, sir. Okay.
Then, any other guess?
You can try by inserting his finger into the throat, which will
Yes.
cause vomiting reaction.
Yes, yes. This is the method. Try to bend the person to forward or put him, lie on him into the on his back, tilt his face, try to put your finger, 2 or 3 fingers into his mouth and forcibly and induce vomiting. That is the better method. Rather than going for daily using lot of salt water, soap water, or whatever water you are going for that. Don't do that. Then check the monitor and the person's airway, breathing, pulse if necessary. Begin rescue breathing and CPR. Now see, this is he has given this point to monitor. Now see what he says is check for a person's airway breathing. Of course, we'll see his rising and falling of the chest. Pulse if necessary, we can check depending upon his neck or whatever wrist by taking the risk. And if he's not breathing, then you can go for CPR. Now, can anyone guess how you can tell a person is going to die or he can be rescued if given even medical what you call help in the hospital? Can anyone guess? Like there is a person who has taken the poison to suicide. Okay, you came to know. But all these are there, breathing and all, rescuing and all. You tried his breathing well, his what you call, and his pulse is also normal. But how can you tell whether he'll, even if you take to the hospital, he'll survive or he will die?
By checking his
pupils.
Yeah.
Yes, how?
By inserting light, if we'll focus some light on it, it will shrink.
Yes, if it
People
shrinks.
in
Yes, you're right. But if it shrinks, then
His neurological activity is correct. Means it's going well.
yeah. See, if dilations are there, that is what we say, dilations. Dilation of the pupil is good. గణేష్ గారు ఏ పాట కావాలి మీకు తెలుగులో? గణేష్ గారు మీకు తెలుగులో ఏ పాట కావాలి? See, dilation of the pupil, depending upon the, if it dilates, then there is 100% chance that person will survive. If there is little dilation, then also there are chances. But if it doesn't dilate, then he is in the last stage. ఇదేంటంటే సూసైడ్ కేసులు కొన్ని ఉంటాయండి గణేష్ గారు. సూసైడ్ కేసులు ఉన్నప్పుడు మనిషిని బ్రతికించొచ్చా లేదా అనేది ఎట్లా తెలుసుకోవాలంటే, టార్చ్ లైట్ తీసుకొని ఆ విక్టిమ్ యొక్క కన్ను మీద ఒకవేళ లైట్ వేసినట్టయితే ఆ ప్యూపిల్ లోపల ఉన్నటువంటి బ్రౌన్ కలర్ ప్యూపిల్ డైలేషన్ అంటే తగ్గడం, కానీ లైట్ వేసిన వెంటనే తగ్గింది అనుకోండి, అప్పుడు మనకి ఏంటంటే ఆ పర్సెంట్ 100% బ్రతుకుతాడానికి గ్యారెంటీ ఉంటుంది. అదే డైలేషన్ 50% అయినా కూడా ఛాన్సెస్ మాక్సిమం ఉన్నాయి తను బ్రతికించుకోవచ్చు అని. ఒకవేళ డైలేషన్స్ లేదనుకోండి, మనం టార్చ్ లైట్ వేసిన తర్వాత కూడా ఆ కన్ను లోపల ఉన్న ఐరిస్ కానీ డైలేషన్ అవటం లేదనుకోండి, అప్పుడు ఏంటంటే మనం హాస్పిటల్ తీసుకుని వెళ్ళినా డాక్టర్ ట్రై చేస్తాడు, కాకపోతే ఛాన్సెస్ అనేది చాలా తక్కువ. Then try to make sure that the person has indeed been poisoned. Like in last slide, I told you cyanosis. If there is depletion of oxygen, then you cannot, you'll have to check whether this person has really taken the poison or it is just because of asphyxiation, that is deficiency of the oxygen. ఎట్లాంటి పాయిజన్ తీసుకున్నప్పుడు ఏంటంటే మనిషి ఒకవేళ కలర్ చేంజ్ అవుతుంది అనుకోండి, అది తను నిజంగా పాయిజన్ తీసుకున్నాడా లేదంటే సఫోకేషన్ వల్ల ఆక్సిజన్ లెవెల్స్ తగ్గడం వల్ల అది బాడీ బ్లూ అవుతుందని అది కన్ఫర్మ్ చేసుకోవాలి. it may be hard to tell. Now this bluing, if it is cyanosis condition, then it will be difficult to guess what would have happened. Dilation meaning in English is the contraction and expansion of the iris. Dilution and ఏంటండి? It is a condition where the concentration is changing to a lower level. Iris when you put the torchlight on the iris, what happens? It contracts and expands. That is what it means. Now, how to identify if a person has taken poison? మనం ఎట్లా గుర్తిస్తామంటే some signs include chemical smelling, breath burns around the mouth, difficulty in breathing, vomiting or unusual odor on the person. If possible, identify the person. ఇప్పుడు ఎవరైనా సూసైడ్ చేసుకున్న వాళ్ళు ఉన్నారు అనుకోండి, ఏ పురుగుల మందు ఏదైనా తీసుకున్నారు అనుకోండి, వాళ్ళని ఎట్లా గుర్తిస్తాం? నార్మల్ ఆక్సిజన్ తక్కువైందా లేకపోతే తను పాయిజన్ తీసుకున్నాడు అంటే వాళ్ళకి మనం స్మెల్ చేసామనుకోండి, ఒకవేళ కెమికల్ మింగినట్టయితే ఆ కెమికల్ స్మెల్ వాడి బ్రెత్ లో వస్తుంది. ఏదైనా హార్ష్ కెమికల్స్ ఉన్నాయనుకోండి, ఫర్ ఎగ్జాంపుల్ ఏ యాసిడ్ లేకపోతే ఏ కాస్టిక్స్ అంటే క్లోరిన్ బేస్డ్ ఏమైనా తీసుకున్నాడు అనుకోండి, ఆ మౌత్ దగ్గర తీసుకున్న దగ్గర చూసినట్టయితే బర్న్స్ కనబడతాయి మీకు. తర్వాత అట్లాంటి వ్యక్తి తీసుకున్న తర్వాత పాయిజన్ తీసుకున్న తర్వాత మీరు సినిమాలో చూసే ఉంటారు, ఆ బ్రీతింగ్ అనేది చాలా ప్రాబ్లమాటిక్ గా అవుతుంది. తర్వాత ఒకవేళ పర్సన్ కానీ వామిటింగ్ చేసాడు అనుకోండి, ఆ వామిటింగ్ నార్మల్ స్మెల్ కంటే అది కెమికల్ స్మెల్ వస్తూ ఉంటుంది. సో దాన్ని బట్టి ఏంటంటే మనం కన్ఫర్మ్ చేయొచ్చు తను నిజంగా ఏమైనా పాయిజన్ తీసుకున్నాడా లేకపోతే నార్మల్ ఆక్సిజన్ తక్కువ అవడం వల్ల బాడీ బ్లూ అయిందని. Do not make a person throw up unless told to do by poison control or healthcare profession. Now here, do not make a person throw up is like, losing the hope that you can save him or just lost the hope. That is, unless the healthcare professional certifies that there is no hope that you can save him, then you can leave the person. ఎట్లాంటి ఏంటంటే మనం ప్రయత్నాలు మనం చేయాలి. ఆ హెల్త్ కేర్ ప్రొఫెషనల్ కన్ఫర్మ్ చేసాడు అనుకోండి, ఇంకా బ్రతికించలేము, అన్ని విధాలుగా చెక్ చేసిన తర్వాత అప్పుడు మనం అట్లాంటి వ్యక్తిని మనం వదిలేవచ్చు. Then, if a person vomits, clear the person's airway, wrap a cloth around your fingers before cleaning the mouth and throat and save the vomit. Now, this is very important to save the vomit in some sort of polythene bag, just to show the doctor what the situation or the condition of the person is and what he might have taken. And it is easy for the doctor to take the remedies that he can start the treating of the person. ఎట్లాంటి కండిషన్స్ లో పాయిజన్ లో తీసుకున్నప్పుడు ఏంటంటే ఒకవేళ వ్యక్తి వామిటింగ్ చేస్తున్నాడు అనుకోండి, అప్పుడు ఏం చేయవచ్చు అంటే సింపుల్ గా మన హ్యాండ్ కి లేదా ఫింగర్స్ కి ఏంటంటే క్లాత్ మనం చుట్టేసి తన మౌత్ క్లీన్ చేయవచ్చు. ఆ తర్వాత వామిటింగ్స్ ఏదైతే అది దాని తర్వాత ఏంటంటే ఎయిర్వేస్ కూడా మనం క్లియర్ చేయాలి. ఒకవేళ తను వామిటింగ్ చేసాడు, ఆ వామిటింగ్ ఏంటంటే కొద్దిగా పాలిథిన్ లో పెట్టేసి అది డాక్టర్ దగ్గరికి తీసుకుని వెళ్ళేటప్పుడు ఆ వామిటింగ్ అనేది చీపిస్తే డాక్టర్ కి ట్రీట్మెంట్ అనేది చాలా ఈజీ అయిపోతుంది. ఎందుకంటే ఆ వామిటింగ్ కండిషన్ పెట్టి తను అసెస్ చేయగలడు ఏ టైప్ ఆఫ్ కెమికల్ తీసుకుంటున్నాడు, ఏ స్టేజ్ లో విక్టిమ్ ఉన్నాడు, ఏం ట్రీట్ చేయాలనేది చాలా ఈజీ అయిపోతుంది. సో ఆ వామిటింగ్ అనేది మనం సేవ్ చేసి హాస్పిటల్ తీసుకుని వెళ్ళడం చాలా మంచిది. It may be help to experts identify what medicine can be used to help to reverse the poisoning. Just now I have told that depending upon the vomiting, the condition of the vomiting, he can assess what medicines he can give immediately to save the person's life. సో ఎట్లా ఇందాక చెప్పింది, ఇప్పుడు అది మనం శాంపుల్ తీసుకుని వెళ్ళాం అనుకోండి, ఆ వామిటింగ్ శాంపుల్ దాన్ని పెట్టి డాక్టర్ చాలా ఈజీగా ట్రీట్ చేయొచ్చు. If a person starts having convulsions, then start first aid. ఇప్పుడు పాయిజన్ తీసుకున్న వెంటనే ఏమైనా తేడా కనబడింది అనుకోండి, అంటే బాడీలో పాయిజన్ ఎక్కుతుంది, ఇమీడియట్ గా మనం ఫస్ట్ ఎయిడ్ యాక్షన్ ఉన్నా లేకపోయినా తీసుకోవాలి. Then keep the person comfortable and make the person should be rolled on left side and remain while getting or wait for medical help. Now here this position left side is very important. Now can anyone guess? ఇక్కడ ఏంటంటే పాయిజన్ తీసుకున్న వ్యక్తిని మనం కంఫర్టబుల్ గా పొజిషన్ లో పెట్టాలి. దాని తర్వాత లెఫ్ట్ సైడే అంటే ఎడం పక్కే మనం ఆ పర్సన్ ని లైట్ గా టిల్ట్ చేయాలి. ఎప్పుడు వరకు? అంబులెన్స్ వచ్చే వరకుని. అది ఎందుకని? వై ఇట్ ఈస్ ఆన్ లెఫ్ట్ సైడ్. This you can observe even after having very good bit extra quantity of food. To get relaxation, we go and sleep to tilt to the left side and sleep. If you tilt on right side and sleep, you can feel the difference between left side and right side. Now, what could be the reason here that it is on the left side?
స్టమక్ లో నుంచి అది మన
Yes.
బ్రీతింగ్
పైకి
అండి
వచ్చేస్తాయి. స్టమక్ లో ఉన్నవి బయటికి వచ్చేస్తుంది.
అంటే స్టమక్ డిజైన్ మీరు చూసినట్టయితే లెఫ్ట్ సైడ్ కి కొద్దిగా బెండ్ అయి
బ్రీతింగ్
ఉంటుంది.
సార్.
సో వామిటింగ్స్ గట్ట ఇండ్యూస్ చేయడానికి ఏదైనా సరే చాలా ఈజీ. ఇట్స్ వెరీ ఈజీ టు మేక్ హిమ్ వామిట్ అండ్ గో ఫర్ clearing of his airways and other things. If a person has spilled on person's cloth, remove the clothing and flush the skin with water. So here it's very easy. If the clothes are dirty because of the vomiting, you can just take out his clothes, wash and give him. Any questions regarding this?
No,
Anyone?
sir.
No questions? See, this first aid I have taken as per your syllabus. It's not in depth. In depth, there are a lot of things that we need to tell. So that is out of the scope of your syllabus. So I haven't taken that. Okay, in the picture, if you see, I'll just try to show. What is this particular plastic? What is this dummy doll? What it is called? What you will call this? On which the CPR is practiced? For first aid training, we have this dummy one. We ask everyone to practice on this. Using mouth to mouth respiration or mouth to nose respiration. What this is called? Can anyone guess what it is called?
Mannequin, I said.
Yeah, it's mannequin. Now you have this is not automated, but for automated mannequins, you have it gives you the reading whether your performance of CPR is exact or not. Then we also practice on this the AD method. So I'll. So you don't have any questions on this? In next session,